I'm Dr. Howard Zucker, the doc in Docology. Our guest today embodies a style of public health leadership rooted in empathy, responsibility, and a vision for the greater good. And I was lucky enough to witness that up close. Tommy Thompson served as the Secretary of Health and Human Services during the George W. Bush administration, and I had the great privilege of working under him, first as a White House fellow assigned to HHS, and then as Deputy Assistant Secretary of Health. We worked closely during the tragic days of September 11th, 2001, the anthrax attacks on the Capitol, which happened just after that, a couple of weeks after that, the emergence of a deadly SARS virus in the world. We focused on preventing disease as much as treating it. And we also worked on the early days of Medicare modernization. And through it all, Secretary Thompson spearheaded numerous groundbreaking public health initiatives, not just in the United States, but also all around the world, and some of which are under threat today. He took me under his wing. He trusted me with real responsibility and became a true mentor. So, Mr. Secretary, I am thrilled to welcome you to Docology. It is great to see you today. And so,
first off, it's my tremendous honor to be on your program, and I hope your program is hugely successful. As I've told you many times, I don't know anybody more talented and more educated than my friend Howard Zucker. I loved having you with me. You were my partner. You were not my employee. You were my partner. We went around the country. We went around the world. We've been in countries and where there's been hostilities, and I know your mother was a little worried about you a couple times being with me, but we always made it out, and we always accomplished something. And I love the fact that you were right there with me, and we were able to really make some progress in many great areas.
Thank you. And my mom says hello because I told her, I said, I'm going to be speaking with you. She says, oh, please tell him I say hello, because she came down with my dad and still has the picture of the three of you in the office. I remember that. And
they're great parents, and they loved you dearly, and you loved them, and it's great. A Jewish family staying together and being so supportive of one another. I love it, and I thank you so very much for having me on your program. Please give my best to both your mother.
I will, and same to you and your family. You have 9 grandchildren. That's quite amazing, really.
Three children, and each child has 3, so it works quite symmetry.
They keep you busy. Little kids can keep you really busy. I know that.
Yeah, I was at one of my granddaughter's basketball games over the weekend. They're all good athletes, better than me, so it's fun to watch them.
Well, always good. They enjoy things. Kids love to do everything. It's like, which is.
And you have 2 wonderful.
I have 2 little kids.
Yeah, when you were with me, you were too darn busy to even date, if I remember.
That is so true.
I got to study. I got to get this done for you, Mr. Secretary. I don't have time to date. But now you married a lovely woman and got 2 great kids. I'm so proud of you. So happy for you.
Thank you so much. So I was barely at the HHS building. I was only there 4, 5, 6 days when September 11th happened, and I didn't know my way around the building. And you took me up there. You took me to Ground Zero. We went up there 2 days after that. We saw the devastation there. We also saw the firefighters in the hospital, and all of the and the makeshift command center with the mayor and the governor there. It was just an incredibly sad day. I was wondering what you were thinking about at that point in time. I mean, it was a tough time for the country.
Oh, it was terrible. Everybody was just devastated. Nobody knew what happened, why it happened, and how are we going to overcome this. And I still remember that day like it was yesterday or today. It was a beautiful day going up on the train, but when we got there, the skies were full of asbestos and debris. You couldn't do it. We met with the governor, and we met with the mayor, and you were with me all the way, giving me advice and telling me all about New York, because you grew up there and you knew what was taking place. And we went down, and I still remember going down the street towards the Twin Towers, and nobody, the stop and go lights were out, but nobody in New York, till this day, surprises me. Nobody honked their horn. Nobody was pushy. Nobody smiled. Everybody was very serious, but everybody was courteous. It was like a whole new world. And people were just so concerned, but they were so pro-America and so pro that you and I were there immediately. We were there before anybody else with the federal government. Howard Zucker and Tommy Thompson, the team, to help out whenever we could.
I remember the American flags were all along that West Street, all the way down. Then we went back up. I remember it so well. I know it's very, very sad. We went to the morgue, and it was just tragic, absolutely tragic. And I remember going back. You had said on the way back from there, you said this is way more than just a physical toll. It's going to have a mental health toll on everyone. And then you said to NIMH and the National Institute of Mental Health, we need to tackle that. I mean, just leadership in action. You said we got to start to look at what's going to happen. People are going to have a hard time dealing with this whole issue.
Yeah, and they did, and we were appropriately there before all of this really developed. We were there when I think the last person was found alive. We came down the street and we went to the morgue, and relatives and loved ones were standing there with hairbrushes and with toothbrushes and so on, to help out and trying to bring closure, trying to find their loved ones, pieces of their loved ones. It was so sad. You and I went in the morgue and talked to those wonderful people working, and they said, please, we need help. And we said, there's going to be mental health problems. And we turned to our assistant, Charlie, and says, you got to set up a conference. He said, well, we probably can do one next year. And I said, no, it's got to be this year. And it was set up for November 19th that year. About 2 months later, a national conference on mental health to help out New York and the citizens and the people, the volunteers that were involved were suffering. And then remember, we had to get all the dogs up there, and we had to get veterinarians up there to take care of the dogs, to help sniff out anybody that might be alive or body pieces. It was just so moving and so graphic. It's hard to explain, but it's there. It's in your mind, your memory, and you'll never forget it. And then you and I went down to the hospital to meet with patients in the afternoon. And it was so, I still can't get over how caring they were, how happy they were that you and I were there to see them, Howard.
I remember it so well. All of your senses, smell, touch, feel, right? The sounds, all of you, just, it was unbelievable. Yeah, it's like yesterday. That's how well I remember. And I remember the train ride back and seeing the whole trip back. It was just really tragic. But what captured me is the country came together. On both sides of the aisle, it didn't really matter. Everyone was looking for solutions of how to make things work, and that was excellent. I mean, now it's so much different, and I wonder, like the Democrats and Republicans, you had in your office, you used to bring this late Senator Ted Kennedy in, and he ran the health committee on the Senate, and he'd come into your office to talk about things. He brought in those 2 Portuguese water dogs. They used to sit by your sofa.
Splash was one. I can remember
that. They come in and they sit down, and you may have had disagreements in policy, but it wasn't personal. So, like, what happened? Why has this all changed like this?
I don't know, but if you remember, when we came back off that train ride up to New York and back, we went over to the Capitol, and the people were walking with candles, Democrats, Republicans, man, woman, child, everybody, and everybody nobody smiled, everybody had somber, singing songs about America. And we walked around in the pond there outside of the Humphrey Building, thousands of people, employees, and they didn't care if you were a Democrat or Republican. All they cared about, you're an American. We're going to build our country. It was the greatest feeling I think I've ever had about the fondness of America that came out of that disaster. People really came together, and that's what we need to do today. We need to bring people back together. You can disagree. You don't have to be disagreeable. Teddy Kennedy and I, we disagreed on a lot of things, but he was my friend, and I was his friend. And we would do things together to help each other. And that's the way our country's got to get back to, Howard.
I so agree. And we found a way to look at the national goals and focus on what the national goal is, not an individual goal or a political goal. And one of the things you do is the whole Medicare reform. I mean, that was a signature HHS work. In fact, I remember when you took your Harley Davidson motorcycle to the front steps with there must have been about 30 people on motorcycles to advocate for Medicaid reform. And actually, curiosity, do you still have a Harley Davidson motorcycle? I bet you do.
I gave my Harley Davidson to the State Historical Society.
Ah,
So that the motorcycle went all around the United States, and I thought it'd be good for the students that come to the brand new State Historical Society. It's there, it's going to be mounted, and kids are going to be able to get on it and ride it. But yes, I brought people together and motorcyclists and everybody else to talk about the need for healthcare. Everybody needs it, and we got to be able to improve the efficiencies and the quality. And that's where you came in, Howard. You were my doctor. You also were my personal doctor, even though you didn't, you were not practicing in DC at that time. You were my personal doctor because you were right next to me, and you kept helping me, advising me how we might be able to make the system better. It was a great team effort, and it made things work. And that's what we have to do in America. Medicare's got problems, Medicaid's got problems, and we have to fix it. We have to do it. And as you know, we completely redid Medicare, and we had Part D, which was a tremendous success. Nobody gives us credit for it, but it was our idea from Health and Human Services to come up with Part D. And you and I were over in the Capitol getting enough votes to get it passed. Part D is a huge success story, and that's a lot of it comes from you and myself in the department, my friend.
right. And Tom Scully, who did this, and I had Tom
Scully was there with us all the way. Right. Absolutely, it was a great day,
and that's the prescription,
and a great goal and a great accomplishment.
Right. And Part D is the prescription drug plan, which everyone it's critically important to so many people in the country. But now they're saying with Medicaid, there's like 12 million. One side says 12 million people are going to lose coverage. The other side says that it's not going to be a loss of coverage. It's just not going to expand. But how do we then provide safety net coverage for those in need? Because you did this in Wisconsin with Badger Care, which was basically to help women and children get coverage. So how do we do that?
Badger Care was an idea that I came up with, and that was probably the best health care for low-income people in the country. I know Mike Dukakis gave me credit for a Democrat and I who didn't agree on much, but on Badger Care, he said it was the best program in the country. And what basically I thought of is how do poor working people that don't have the money for health insurance be able to get coverage for their children and for themselves and their spouse? And that was my ultimate objective. If you're really poor, you can get on Medicaid. If you got money, you can buy it. But the poor bloke, an individual small businessman, the farmer, the laborer that's out there working day in and day out, not asking for anything, just give me some help. That's what Badger Care was all about. And that's why I set it up to do, is to get the working man and woman coverage for themselves and their children. And it's still in existence and it's still working. People in Wisconsin love it. And Democrats now are touting that as their number one accomplishment in some areas, even though it comes from a Republican, Tommy Thompson. And I love it. But that's what we need to do. We need to work together because good ideas come from Democrats, good ideas come from Republicans. And we got to forget about this partisanship and get down to saying, we got a problem here. Let's bring the best minds, the best ideas from the Democrats, the best ideas and minds from the Republicans, put them together and come up with a solution. That's what you and I did. We never asked about Medicaid or Medicare or Part D if it was a Democrat idea, a Republican idea. We just bounced ideas off of yourselves, Tom Scully and everything. And we didn't care who got credit for it. We just wanted to get the job done. And that's what needs to be done today, Howard.
And I agree with 1,000%. And the current healthcare coverage system is struggling. I mean, what works for it and what doesn't work in the system right now? Is there something you think that we should be doing differently, separate from the politics, just in general, to get more coverage for people who need that care, like what Badger Care did?
There's several things. Number one, you've got to get more people to go into healthcare. We don't have enough doctors, we don't have enough nurses, we certainly don't have enough technicians, we don't have enough research analysis. We got to get young people to realize this is a fantastic career. We may have to subsidize and help them get through, but we got to look at this area And people that want to go to college may need some help, want to go into that areas. We got to help them. Number one. Number two, we got to give access. We got, what we have is we don't have enough doctors and nurses to take care of the problem. And we're going to have to figure out, maybe nurses are going to have to do more, maybe physician's assistants and supervised by doctors so that everybody gets coverage. It's not rocket science. You need somebody there to help administer the medicines and so on. 25% of the people never take their medicines. And and what happens, 50% of the people get hung up on drugs because they go to a doctor and who prescribes too much pain-killing medicines to them that they get hung up on it. These are problems that are not difficult. No, they're difficult, but they're not radical ideas. You need to find solutions. And we can do that, Howard.
I agree with you.
Put you and me in a room and we'd come up with 10 solutions, and I would say in an hour.
I would love to do that. That would be a great thing to just sit down and just brainstorm about what to do, because the healthcare system's changing. I've been through it. I'm sure been through it, where
absolutely.
It's not what it was.
It isn't.
I mean, 15 minutes with a doctor, that's not what we want. And
9 minutes.
9 minutes. Look at that. Isn't that amazing?
9 minutes for a doctor, that's all you get. And plus, you have to wait sometimes 6 months, 9 months to see a specialist if you got cancer. That's not, you got to, all of us know that if you treat cancer early, you get a chance to survive. You got a chance to remedy the disease and kill it. But if you wait 6 months, it just keeps growing. You've got to be able to get in and get some attention and see it. And there's no way to get in and see doctors right now.
And all the doctors are leaving, and there's another challenge, and the system it's broken. I wrote an article in AARP about where have all the doctors gone, so I'll send that to you about
I appreciate
what happened to the system. And also I think doctors are just we need to expand, particularly with nurses, the scope of practice of what they can do and have them do more. Back on one of the questions that I was wondering about with Medicaid and Medicare in general, Medicaid particularly, you were the governor, and what is the state's responsibility? What is the federal government's responsibility? Because you've been on both sides of this. You've seen like what the state should do and what the federal government should do.
I think truthfully, I think it's a great partnership. It's broken, but it needs to be completely overhauled. But the truth of the matter is a partnership. State pays part of it and sets the rules and regulations. Federal government pays parts of it and sets the overall rules and regulations. And it's worked out very well. It treats millions of people, and we got to maintain that. We're not going to have public health, in which everybody's taken care of by the government. So Medicaid has got to be the substitute, and we got to take care of it. The problem is there are some people on Medicaid that don't need to be on it. And there's some people that are on it illegally, and they shouldn't be on it. And there's some people that are not on it that should be on it. And you got to be able to review all of the rules and regulations, make it simpler, make it understandable, and have people that are going to supervise it and do it better. It's not rocket science, but it can be done. But you're right, it's broken. Medicaid's broken, Medicare is broken, Medicare is going broke in 10 years? And that's really scares me. And we got to come together as Republicans and Democrats, but we'd rather fight. Instead of saying what we're going to do, we're just saying, well, elect me because I'm better than that guy. He's bad or she's bad. Let's get down to solving problems. Let's get candidates, something really radical, Howard. Let's get candidates to come out with what they're going to do before they get elected. Instead of just saying, you got to elect me because that other person's just bad. That's what everybody's doing now. That's ridiculous. I always set out a whole agenda what I was going to do when I was running for public office. I think we got to get back to that.
Well, that's why you were the 14 years as governor, the most popular governor in Wisconsin, because you said this is what we're going to do. This is what we're going to do. This is how we're going to fix things. And it's just amazing. I mean, I saw it at HHS. 6 weeks after September 11th, we had the anthrax crisis. You said the same thing. Let's figure out how to fix this problem. Go up to Capitol Hill. It was shut down. Let's figure out how to make the country respond to this. And I remember you once saying that the country was not prepared for this kind of terrorism.
It
And
was.
and you built that command center right opposite your office, and you created an Office of National Security, Intelligence, and Defense with a line. I remember this right from HHS right to the White House, so that they could hear exactly what's going on, and you can hear what's going on regarding any public health emergencies, which is visionary. So, I mean, what made you realize that we were not prepared for these kind of crises?
Well, it was pretty obvious because nobody was really putting money into public health, Howard. That public health was not the squeaking animal that was requiring Congress to put money in. So and nobody was there really advocating for public health. So as a result of that, Congress was taking money away for their special items, whether it be defense, whether it be for foreign aid, whatever the case may be. But public health at the state level was just being starved. And so when we got there, we realized what we had to do is we had to rebuild the state's public health system. And
Listen.
Oh, I think we might have lost him. We'll get him.
He'll come back. He'll come back.
Give him 2 seconds. He was telling a great story too.
I know, it's a great story.
Yeah.
Yeah, Howard, I think you want to ask him, how do we get this bipartisanship?
Well, that's my next question in here. That's when I'm going to go into the public health emergency response.
Yeah, because we were on that track, and now we're on something else. But it's great. Your report is great. He's delightful. I mean, he's
a great guy. I loved working for him. Let's see how we get him back on.
I'm going to give him a call really quick.
Okay, give him a call.
good idea.
It was an absolute pleasure working for him. Every day was like that, just like he is today. Every day.
I'm so sorry.
There we go. Perfect. Excellent. So you were mentioning that we have public health. The states were not. They don't have enough of the public health support, and that's a real challenge. And for not just the little states, all the states, big states included, right?
But what happened is after anthrax, the federal government and the president said, do whatever you need. And I said, the first thing we have to do is we have to rebuild the state's public health system. And if you remember correctly, we did that. And for many years thereafter, they were putting money into public health. Guess what's happening today? They're taking away money from public health. And that's going to come back and hurt us, because the states have got to be the first line of protection for our public health system. And if they don't have the money and the resources to set it up, it's going to come back and hurt us.
So how do we do this? How do we get more money put into the public health system? Is it Congress? Is it advocacy? Is it just pushing hard and being?
It's Howard. It's all of the above, and it's people like you on Docology telling the story. You know the story firsthand. You're in the catbird seat to do it. I got to be giving more speeches out there across the state of Wisconsin, saying you gotta support public health, and you do. If we don't do that, the public health system has already got big gaps in it, and we got to make sure that the gaps don't grow. That we start solving them, filling in the gaps with solutions.
You also started the Office of the Assistant Secretary of Preparedness and Response. And now I would think so. It's been there forever. It wasn't. You put D.A. Henderson, the person who eradicated smallpox in the world, as the first director, and that was smart policy. And the thing was, he was a lifelong Democrat, but you put science before the politics. So how do we get back to making sure these public health decisions and appointing people are based on the science and not the politics?
It's hard, and D.A. Henderson was a giant. He was the leader in being able to stamp out smallpox, and he did not want to come in. He was retired, if you remember correctly, and I called on him and I leaned on him, and he said, "Oh, I don't want to come back into government." And I said, "Well, think about it." And I called him back on Sunday. He said, "I still don't want to come in." I said, "Let me talk to your wife." And then Sunday night he says, "Oh, all right, I'll give you a couple of weeks."
That turned into more than a couple of weeks.
Yeah, he built the whole department, but I needed him. He was brilliant, and he was fantastic, and it was wonderful. And of course, I had my right arm there, Howard Zucker, whispered in my ear, my good ear, one I could live here.
Well, I remember coming into my office and all my stuff was out there, and I said, "What happened to my stuff?" It was over Veterans Day weekend, and I remember someone said, "Well, it's now DA's office." I said, "Okay." I said, DA is going to be building a whole preparedness response. I remember that day. It was a weekend he came in, and we worked really closely. It was incredible work. And then as a result of that, SARS happened, which SARS is a viral cousin of COVID. And the command center was now up and running. So we were able to do the stuff that we could not have done before.
Right.
And I remember you gave me this paper from CDC and you said, figure out what we need to do here, because I guess CDC gave you a memo saying this is a concern. And you said, go in classic Secretary Thompson fashion. You said, figure it out, go do it tonight. And then I stayed up all night and put my scrubs on, stayed up all night and came up with like a plan, a framework plan, which then went into the whole SARS response plan. But you said, we've got to fix this. We can't let this disappear, just ignore it.
And remember, Howard, how we at 9:30 every morning we went into the command center and connected with CDC and NIH and FDA and World Health Organization, and we got responses because of the command center. You and I, and other individuals we had a great team. It wasn't just you. You were exceptional, of course. But there were many others. But at 9:30 every morning, we went in and we got caught up on everything that happened the night before, the day before, since our last meeting, and we'd signed something to do them, and they had to give us reports back what they were doing to solve the problem, and that worked, and it worked extremely well. In fact, I did the same thing, replicated it when I became president of the University of Wisconsin. I built a command center, and at 9:30 every morning during COVID, I had every campus report into me at 9:30 in the morning. They didn't like it at first, but then it became automatic, and everybody saw the benefits of it, and it really worked out well.
Wow, how clever. Yes, you had Ken Bernard, who I had on. He was in charge of the intelligence and biosecurity.
He was.
Right. And he was on a couple of weeks ago also talking about some of the global health issues. But it was amazing. It was amazing what we were able to do. But now I feel like we're fighting each other in the government rather than fighting the threats that are out there. So I guess we have to go back and try to focus on what we really need to do. On that.
And if you remember my last speech, my last day was, I said, the thing that I'm the most concerned about is food safety.
I remember that very well.
And I still am absolutely worried about the sanctity and the safety of food that we're importing from all over the world. I'm just really still worried about it.
I remember that because you gave that speech downstairs in the conference, in the press room, and then you mentioned about food safety, and we went up that elevator, and I said, boy, that was a little out there, and you mentioned it. I said, the White House will probably be calling you by the end of today. And then you said, we got back to the office and the White House was on the phone. I said, well, I guess it's not by the end of the day. And they called right away. I was like, but it changed. We started to work on food safety and some of the issues, and we still need to do that. Do you think they're doing that now in government? Do you think we're doing it?
I think Bobby Kennedy is very concerned about
it. In what ways? Yeah.
Yeah. But I don't see anybody really looking at how do you protect the importation of food, and that's still a huge worry.
And it's a huge issue. You mentioned the Secretary Kennedy, and FDA was another issue that I wanted to touch on because you did an amazing amount of work. You pushed forward on all of innovation. And what happens? How do we keep doing this? Because there are a lot of people losing their jobs at HHS, and they're doing this reduction in force. What do you think about that, and how do we address it? Because one of the things I remember is you made everyone feel in the department that they are critical to the mission of what we do, and HHS touches every single person in the country. So
every day.
Yeah.
Yeah.
And so what happens now? What do you think about all these cutbacks in the agency?
Well, I'm sure that there is need for some reductions. I'll never accept the statement that we can't cut anything. We can make things better, and we may have to move some people from Department A to Department B to make it better, because healthcare, you know better than anybody, being the doctor with 20 degrees. I always love to tell people, this guy Howard Zucker's got more degrees than anybody else in America, and I love him for it. He's dedicated. But the thing is, healthcare is not stagnant. Healthcare changes. We have different viruses. We have different bacteria. We have, we're a global society, and things come and go. So you got to be prepared. You got to be looking at what's out there. You got to start reforming the department so that the department and can respond quickly. And I don't think we keep that in mind. We look at the status quo. Status quo to me means we're losing. You got to look out. You always got to be, as I told you before, if you're not looking over the edge, you're taking up too much space. And so you got to be looking out there into the environment. How do we solve the problems and make it better? How do we make our healthcare system efficient? And I would personally, you asked me what I would do. I would put people in charge like Howard Zucker, people that are working individuals that love to work and get things done. I say, here's your assignment. Come up with, and I don't care who you use or who you bring in, but you have a report back to me in 12 hours as to how we can improve this agency, how we can improve this, how can we administer the healthcare better. And I know darn good well, you would do it, Howard, but there are other Howard Zuckers out there. There are other Howard Zuckers out there that need to be tapped, to be brought in, and give them the authority to do it, and give them the responsibility to get it done. And be amazed how you can start making government more efficient and better, and probably smaller.
Yeah,
more efficient.
More efficient. And I admire that you were willing to give me those assignments. And I remember one even on tissue engineering, regenerative medicine, where we could do research in an innovative way. And you got a letter and you gave it to me and you said, then do it, fix it. I want to touch on University of Wisconsin for a minute, because you've been in academia, public service, you've touched all of this, and Wisconsin is a powerhouse for scientific research. And you sent me out. Here's another example. You sent me out to Jamie Thompson, no relationship, right? Spelled differently. You sent me out there, right, to go look at WARF, which is the Wisconsin Alumni Research Foundation, where they were doing, he created the first embryonic stem cell, human embryonic stem cell. And now the organization there has 1,500 stem cell lines. They've sent it to 1,000 institutions in 45 countries. And you, as the governor, when you were the governor of Wisconsin, said this is the future. So I was curious about how federal government, when it steps into the university world, what role should they be playing in touching into what university research does?
There's not nearly enough collaboration. The federal government needs to be able to inculcate the professors and researchers from the university, and the university's got to realize the federal government has a role. Universities are too insular, Howard, and they've got to be much more cooperative with government units, and government units have got to be accepting that. And we've got to be able to give them the responsibility and the authority and the resources to get it done. And that's what I found at the University of Wisconsin. I preached, just like I'm talking to you today, I preached the university, reach out to the government, tell them what you're doing, and invite people in. I love having visitors from the federal government come to the University of Wisconsin-Madison. And I had the Secretary of Health and Human Services. I had several of the division heads come out and speak to the university, and everybody loved it, and everybody got along, and they said, "Gosh, we wish we would have done this before, and we could get it done." That's what needs to be done: communication, cooperation, and don't care who gets the who gets the credit for getting it done. Everybody can take credit for it, and you'll make progress. That's what you need.
You think the same with the private sector? You need to work with the private sector to move things forward.
Yeah, I mean, universities are just too insular. They think they're in the ivory tower and that they're the only ones that know what has to be done, but they don't communicate, and they don't bring anybody in, and that's a recipe for failure, Howard.
Yeah.
You gotta reach out. People got to know about you, what you're working on, and what you need in order to make that more successful.
We definitely have to talk about global health, because I can't think of another HHS secretary who's had bigger impact on global health than you did. I mean, we took those trips to Afghanistan, and I remember being there when you said, we're going to fix the maternal health challenges. We're going to update the hospital, the Rabi Balki Hospital. We're going to educate the people out there with our talking, a way to educate through a talking book, and just the basic obstetrical care. What was that made you realize that global health diplomacy is really the answer to improving America's image across the world?
Well, because global health is going to cause all of our so many problems if we don't participate in it and get involved in it. It's just common sense, and everything is moving so rapidly. And global health is something that I really loved, because I thought America could really show its leadership. And we did that through our Global Health Fund and through the Millennium Fund. And we went to that hospital. Still, I'll never forget it. And you came to me and you said, Secretary, they have no medical books. Remember that?
I do remember that. That's right.
There are no medical books in the hospital. There was a New England Medical Journal, if I remember, dated 1969.
That's correct. That's correct. It was the 1960s in the New England Journal of Medicine. That was the last thing. And we're talking about 2003.
Yeah.
There were no books there.
No books.
Yeah.
And I still remember this. And women had to come in and bring their own sutures when they go to operate. And women doctors could not deliver maternal care to other women. And they put them in this big room with iron beds. It was just, And I told Howard and all the people with me, we got to raise some money and modernize this hospital, get running water in here, and get sutures and everything else. We came back home. We raised the money. We remodeled the hospital. I still remember going over and talking to the Department of Defense, and he wrote out a personal check to the operation, and we raised the money, remodeled it. And then we went over there, and I talked to Howard, and I said, they have no books. And Howard said, yeah, they have no books. So Howard developed a primer. Howard Zucker, the guy we're talking to, developed a primer in 2 languages, Farsi and
Dari and Pashto. Dari and Pashto, right?
Dari and Pashtun, and on how women, and it was not mostly women who were not educated, but it was able to be, you press a button and it would speak to you, tell you how to take care of your child. Nobody had it. The books went crazy all over Afghanistan. Just, simple, nothing great. It didn't cost us that much money, but it was an absolute life-saving. I just wonder how many children we saved, Howard, because of that book, and the credit. You did it, and so you get all the credit. But I love you for it, and that's how we start fixing it. Give people the authority to do it. Say this is a problem. Come up with a solution.
And we did it. And it reached, I think, 8 million people. That's what we had. And we had the thing that was fascinating. The country was all GPS mapped, so we had these testing that we could test and see what they knew and what they didn't know before they read the book and after. And it came right back to the offices at HHS. We said, okay, this is interesting. This area of the country doesn't understand about clean water, and this area of the country doesn't understand about organizations. It was a real success. And that is, you said, let's do it. And we did it.
Yeah.
I remember you said we have to get this done. We need a prototype within 6 weeks. It's like, yep, 6 weeks. You've got 6 weeks to do this. And then we went to Iraq. I mean, that was another one. That trip to Iraq and the Black Hawk helicopters. I remember sitting there with you, and I didn't know if your eyes were closed. I didn't know if you were sleeping or you were praying because we were in the dark of night, with these helicopters in the back. And then we went into the green zone. And then you said we were in the green zone. You said, let's go into the red zone. And I said, well, why are we going into the red zone? You said, I didn't fly all the way over here just to stay in the green zone. And so you took us out into the red zone to help look at how to build a children's hospital. And you did it with USAID and Project Hope.
Yes.
Right.
Yeah.
And so I'm curious also about USAID because USAID has now sort of been dismantled and they were a good partner for us. So how do we get that back together a little bit?
It's partnership. It's got to be. There's no one person that's at fault or anything. USAID would funded some crazy stuff, and they shouldn't fund it, and that brings down the ire of people in government wasting money. And this administration, and I think rightly so, wants to save money and wants things to be more efficient. I think government has to do that because money is fungible and it's a limited resource, and so we gotta be much more efficient. But that's give the Howard Zuckers of our society and the Tommy Thompsons who are in charge the responsibility to do it and say, this is how much money you got. Now fix it, make it more efficient and better, and treat the people that need it. And we gotta get back to that.
I agree that we need to be efficient. I just want to be sure that we're able to provide the care out there because
Absolutely.
the WHO, right? The WHO is another. You were the powerhouse for the World Health Organization at those World Health annual assemblies that they have once a year in May.
Yeah,
but now we're not there.
Remember the little Chinese guy who came up and wanted to hit me in the face?
Oh, yeah. That was bad though. The WHA. But you were the powerhouse for all of that, and even in fact, I remember when I worked because I went to WHO after HHS, and there was the Tommy Thompson Emergency Operations Center. I always smiled when I walked in there because your name was right over the door there. But what do we do now if we're not part of the WHO, or do you think that will change?
I think that will. I think eventually America has to be part of WHO, and I think we will go back in. I have all the reason in the world to believe that that's going to take place.
So you think this is just a temporary situation?
I think there's, the administration is finding its sea legs, and I don't think there's any doubt. But World Health Organization, we are a world, and we cannot. And as you said it, and I've said it, so many new diseases, so many new, and viruses are being discovered or coming into our country. You can't. United States cannot be by itself. We have to be able to have a coordination on healthcare and global health throughout the world because we're a world entity.
I hope it happens soon because it's so important. On the Global Fund, you mentioned it before, and I was looking this up. You were the force behind this, and I looked this up. 65 million lives have been saved because of the Global Fund for AIDS, TB, and malaria. So that is just amazing. I mean, you were the chair of that, right? You were the force behind it, and 65 million people.
Isn't that something? Yeah.
Isn't that amazing?
Yeah, I still can remember Kofi Annan and Colin Powell calling me on a Sunday and saying, what about this? And I said, we should do it. And we did it. And we started out, got President George Bush on a Sunday afternoon, which was difficult, at 2:00. I still remember the time. We were in his office talking about the World Health. And I said, Mr. President, I think we need to put money into this thing and get it started. And he agreed. And he announced it the next day on Monday in the Rose Garden. And now it's an $8 billion operation. And you've said it. We've been able to get antiretrovirus medicines into countries all over the world, and 65 million people in the world have been saved, would have died from AIDS it would have been for the World Health Organization and the Global Fund.
Just amazing. I mean, that's leadership in action and seeing a vision of how to improve something. And I think that all the global health work, I mean, that we could go on forever on all that you did on global health. But one of the other things I realized you recognized was about prevention. Because the first, even though I gave you these thousands of memos, the first one I gave you was about prevention. That was I remember that you asked me, you said, I want to do something about prevention, is when I just had met you. And you said, we all we do is spend money on treating diseases, but we don't spend enough money to prevent it. And you said, let's fix that problem. And do you feel, I'm just curious about your thoughts about that, because there was so many things you did on that.
Well, I mean, you look at it, 93% of the money on healthcare goes to get you well after you get sick, and less than 7% keep you well in the first place. Anybody looking at this picture would have to say, that doesn't make a hell of a lot of sense, and it doesn't. And you and I agreed. And so we went out there. One of the things we did, we got people start exercising again, eating properly. We talked about children's obesity and how we had to get children more nutrition food and need to start exercising. And remember how many little pedometers you and I handed out? I don't know, thousands around the world. You know, we go into meet a Secretary of Health in Ireland and would give him or her a pedometer, and they loved it. And we had a lot of successes. But we made people walk up and down the steps in the Humphrey Building instead of taking the elevator, and we painted the corridors so people would go look at their paintings. I mean, it was just, and I still remember this going around outside and taking cigarettes out of people's minds and saying, I really don't want you to. I got slapped. I remember I took this out of FDA and people didn't work for me. So it was one moment slapped my face, but that's all right.
I do remember that. Do you think RFK, the secretary now, is taking the issue of taking on prevention? How do you view that and what he's doing? Because there's a lot of issues that are.
I think he's doing I think he's doing a very good job in that regard. He's getting publicity on it, and that's the most important thing. I mean, we did a lot of work, but we did not get the amount of publicity that Secretary Kennedy is, and that's extremely helpful, because people have got to know they've got to stop smoking, they got to start exercising, they can't take in so much sugar, and they've got to be able to get healthy and get the obesity problems down in America.
What would you tell him today if you sat down with him and said, okay, or if you were the secretary today, how would you approach some of the things today?
Very simple. I think I'd be doing the same thing he's doing, is calling in people and telling them that they've got to make their foods more and their drinks more nutrition and more protein and less sugary and less color, and it can be done. And so I don't think it's rocket science. It's communication and telling the story and getting it out there to the people to follow. And you got to get into the K-12. You got to get into the classroom. That's where the childhood obesity has got to be. You got to get science teachers. You're going to be talking about it. You got to get nutritionists into the schools and talk about nutrition and about the need to hold down on obesity, and that the direct causes of all of this, of course, is diabetes, and that's just an epidemic in our society.
Well, you took it on. You took on the whole diabetes detection initiative. I remember that across the whole country. What about the issue with vaccines? Would you tell them to sort of? I'm a big
believer in vaccines. I think it was just amazing that we were able to get a vaccine for COVID in less than 12 months. I think that was thing, and smallpox vaccine was a savior to eradicate smallpox. Measles are starting to come back because I don't think people are vaccinating their kids enough. And vaccines are necessary, and I believe good.
Yeah, the measles outbreak is scaring me, because I dealt with it in New York State when I was a commissioner, when we had a big outbreak prior to this one. But this situation in Texas is very worrisome, and we have to get people to recognize the benefits of a measles vaccine to prevent disease, and that's an enormous issue. And I always think about this, because if there was a vaccine for AIDS 20 years ago, 30 or today, people would say, "Oh, I want that." And so I think that we need to push that forward. So that is something which I would like to see, personally, like to see Kennedy take a different approach and push the vaccines harder. And the issue with autism, I mention this because you said this problem with autism is increasing in the country. Go do something. And we had this summit with 900 people, advocates, academia, Congress was there, everyone was there, both sides of the aisle. And the next thing you know, we got money. You got money to do the research for autism. I remember that as well. So we took that issue on. And I guess one thing I will mention, then I know we have questions from the audience. I just want to mention one key thing. When I sat in meetings with you, at that big brown desk in the office, in the conference room there, your private conference room, I used to write notes about what we were working on, but this is a little secret. I used to also write notes about your leadership style. And I had these little notes, and I kept them. And when I became the commissioner and even in my other jobs, I still have them. I always look back on those notes and say, this is how you address X problem, or this is how you address Y problem. And so the leadership style is really something which I'm thrilled that.
Thank you. You're very kind, Howard. Thank you.
And so I thank you for that. Any key takeaways you think that we should remember and think about regarding public health or medicine or policy?
Well, I think what you're doing in Docology is prime. I mean, you need to be national. You need to, you're giving the primer on how you protect yourself and all the current issues on healthcare. There's nobody better at doing that and explaining it than Howard Zucker, and that's why. I mean that sincerely. You got your podcast, but I hope it goes extremely well. But it should be picked up, and it should be across the country, so that people all over can hear what you're talking about and your vision. And I'll do everything I possibly can, because it needs to be addressed, and it's not rocket science. You got to sit down and roll up your sleeve and do the hard work and find solutions, and then you got to communicate it, and you got to get cooperation from both political parties to do it. It's not a Republican problem or a Democrat problem. There's not just a one only Republican solution or a Democrat solution. You got to come together with the best ideas, and you got to be able to say, that's a good idea. I don't care who it comes from. Let's work together on it, and you get the credit for it. That's fine, but let's get it and implement it. There's enough credit to go around, and let's start making healthcare more responsive and better and more efficient, and give more people coverage.
I hear you, and the whole concept of the podcast is to be the antidote to all the confusion that's out there, because there's a lot of confusion. There's a lot of misinformation out there, and I'm trying to sort of say, here are the real facts. Here's what we need to do, and here's how we help Americans, and here's how we improve people's lives. And I think that in the end of the day, that's what everyone's mainly focused on, to improve their life. It doesn't really matter what party someone's on. They just want to be sure their kids and their family and everyone's well, whether here in America or around the world. So that's the big issue. But I want to take some questions, and so I'm going to turn to Kat. This is when we go to our questions, and Kat, maybe you could ask usually I have the first question. Maybe we could jump with Kat's questions.
So I do usually have the first question, but I'm actually going to ask a question from one of the subscribers, and then I'm going to bring up Mitch and James. They both have questions. So the question for you, Secretary, is you mentioned that we need to increase the number of physicians in the U.S., which is a great statement. But at the same time, NIH funding cuts by the president and attacks by the president on higher education institutions that have medical schools, and the elimination of federal loans for many medical students run counter to that statement right now. What action steps can we take to facilitate an immediate increase in the number of medical students?
Well, first
that's kind of a long one. Sorry.
No. The first thing you got to do is you've got to get the information into young people about the importance of becoming a doctor and a nurse, and how important healthcare is, and how they can make a really good living, but they can make a difference. They can make a change. We're not educating the young people of our society enough to go into all of the healthcare fields, and they're all lacking as far as individuals. And so it's wide open. And you can say, well, I don't want to go to school that long, or so what? But start it. And you can go to a technical college and get into the healthcare arena. You can go to the university. And money, people always complain when they cut this, therefore it's going to be. I don't believe that. This money can be had. States can come up with money. Groups can come up. Every disease out there has a group of advocating for it. They can help raise money. Make a real pitch for the manufacturers of your society, how important it is to get doctors and nurses into manufacturing and be able to take care of your workers, and be able to set up clinics at businesses. Businesses should be setting up their own clinics and should be sponsoring individuals that are in their community to go on to medical school and nursing school and all the other fields that are in healthcare, from technicians to radiology, and you name it, and dentistry, and you are wearing glasses, so do I, optometry and ophthalmology. I mean, everyone has got shortages, but we're not telling people. And we got to get the young people interested in going to. My granddaughter's going to become a nurse, and I'm pitching the rest of them to become either doctors or nurses or whatever. And that's what we have to do as a society. But I don't believe it's just money. I think we got to get more young people interested in becoming a professional in the healthcare field.
Right. Great answer. Great.
It's a great answer.
Great answer.
Okay, I'm going to thank you very much for that answer, and I hope that answers our subscriber's question. I'm going to bring up Mitch, who has a question for you.
Thank you. Hi, Secretary.
Hi, Mitch. How are you?
Good. I'm in the medical profession too. I'm at the
Good
end
for
of my
you.
career. And I agree with a lot of what has been said here. But what I can, and almost everything you covered has been shown to be, needed and true, and, getting more people involved. But I can't get past the fact that you did all this work and all these good things when you were secretary, and Howard certainly added to that in his career, certainly as commissioner and working at HHS. What is going on in Congress where there's no movement in the direction of getting better health care, the U.S. taking the lead in global health? It's shrinking and it's moving in a completely different direction than what it should be. And I don't understand why. I don't understand what is going through the minds of these Republican senators, essentially. And since you're a Republican leader, I was wondering if you can help enlighten us.
I think what needs to be done is people have got to realize in Congress that healthcare is a huge problem. And if you listen to the podcast, which you must have, and I appreciate it and thank you for Howard's sake and mine, but Congress has a tendency to only take a look at things that really are causing them problems back in their districts. They're looking at the next election, and they're not looking at the future as much as you would like or I would like. And we don't have the Teddy Kennedys and the Senator Byes and Senator Laxalls and Orrin Hatches working together on big subjects and working on a bipartisan basis. We don't have the leadership in healthcare, that are using their position in Congress and the United States Senate, Mitch, to really advocate and really become the spokesperson for good health care. We just don't have that. I don't know who. If I suppose the Dr. Cassidy is probably the best one. I would like to see him play a more active role. I think he's a great doctor, a great individual, and a good senator. But I would like to have him out there really articulating the needs of healthcare in America. And that's what we need. We need spokespeople in the Congress to advocate the way you and I want things to happen, Mitch. Get more people involved in healthcare. And I don't see that taking place. And we got to encourage our senators and congressmen when we talk to them. You got to take an interest in public health. What takes place in public health is if you're not on it, there's nobody out there in Congress really pushing for more money for public health. I can assure you of that. And as a result of that, public health is getting shortchanged. And we need people like the Cassidys and John Thune to be advocating for more money for public health care at the state levels. That's where the action is. And we have to get more people like you, Mitch, involved, not only in articulating that, but also encouraging your sons and your grandchildren, your sons and daughters and grandchildren, and all your associates to get their young people. It's amazing to me how many doctors and nurses there are in our society, but their children never want to go into that practice. That must mean that they're hearing at home that it's not the right profession to be in. I can't tell you. Every time I'm with a doctor and I say, well, where's your son going to school? What's he going to become? Well, he's going to become a lawyer. And I said, well, why doesn't he become a doctor? That's where we need him or her. And I don't think you or any of the other professionals are talking about the importance of becoming a professional in the medical field.
I agree with you completely, but we're losing our checks and balances. You know, when RFK, when Secretary Kennedy replaces the Vaccine Advisory Board with some handpicked people that are anti-vaxxers, we're going backwards. And you know, Howard already mentioned how measles is becoming a very disturbing problem right now. There's, I don't know, over 1,000 cases. You know, some kids are going to die that are preventable, and I don't know what kind of noise needs to get through. How do you get through to the HHS Secretary that he's causing more harm than good when he does stuff like that?
Yeah, but he's also doing a lot of good. I mean,
Yeah.
I'm every time I hear, you know, Bobby Kennedy get up and take on food companies and talk about the coloring in foods and that they're talking about obesity and childhood nutrition. I applaud him. I did the same thing, but I didn't get as much coverage as he did. And so I give him credit for getting the coverage out there in those areas. You're not, Mitch, the only person you're ever going to agree 100% of the time is that guy that you face in the mirror when you shave. Let's face it. Okay? And you're going to find fault with anybody in that position. But I think
I'm not shaving much lately.
I noticed that, but I still use the analogy. But anyway,
Thank you.
I think that give Bobby Kennedy his credit. I think he's getting out there in a lot of areas that need to be covered. I don't entirely agree with him on vaccination, and you don't either. But let's see if we can educate him. And that's my job. That's my job.
I thought that I think you were secretary when this happened. The FDA commissioner who put the contents of food on labels to let you see what the ingredients were and the percentages and protein. Was that during your?
Yes, it is. And also, if you remember correctly, I also put the barcodes on pharmaceutical drugs that nobody else said. Everybody said that they wouldn't do it. And it came out. Now it's like nobody.
No, I think that's the greatest thing the FDA ever did to enforce health. Yeah. And but anyway, I'm taking up too much time. And I want to thank you very much.
Where are you from,
I
Mitch?
appreciate it.
Where are you from? Okay.
He's in Florida. Mitch is in Florida. So it's like, yeah, he's down in Florida. I've known him for a while because he was a classmate of mine many years ago. And so it's good to see him. And he does anesthesiology down on the west coast of Florida. And we need more anesthesiologists too.
We have one more question, and I will bring James up for that question.
Okay.
Hi, Secretary Thompson. Thank you so much for coming on this podcast.
Hi, James. How are you?
I'm doing all right. How are you?
I'm doing great.
All right. My question is, do you think universal health care is achievable here in the U.S.?
No. No.
No? Why not?
It costs too much, and there's no real emphasis and no great momentum. You got to, like when Howard and I did Part D and redid Medicare, there had been campaigns about it, about drug coverage for seniors all over, and it was becoming a real issue in presidential politics. And when George W. Bush got elected president, he turned to me and he says, now it's your responsibility. Come up with Part D, and from that, or come up with a coverage for seniors. And I did, and there was a department with Howard's help and a lot of other people, Tom and many other individuals that came up with Part D and the renovation of Medicare Advantage, Medicare, all of this stuff was but it was the need to solve a problem. There's not that huge emphasis out there for universal health care. Therefore, and the government's broke. So there's not the emphasis on it anymore. It's not even hardly discussed in presidential politics anymore. It's mentioned, but there's not a driving thing. And number two, the United States government is broke. I mean, we're 36 trillion, soon to be $38 trillion in debt. When you have that much money that you owe, and then to take on universal health care, it's not on the cards. I'm sorry to say, but it's not on the cards, James. And it's not going to happen.
Gotcha. Thank you.
Thanks, James. Kat?
That is the last question.
Well,
we can go ahead and wrap this up.
Thank you. And thank you all for your questions. And thank you, Secretary Thompson. I mean, listening to you just now, it sort of takes me back memory lane, and as if I hopped in a time machine and went back 20 years, more than 20 years, sitting in your office or in that helicopter or the back of the car. And we just talked about the next public health crisis that we needed to tackle. And I sort of miss those days. I miss your leadership. I miss your vision and your humor and sense of humor and sense of purpose of doing things to fix the problem. I think that's exactly that we need. And I think that the world needs that right now, a lot more of that in order to move things forward.
World needs it right now.
Right,
yeah.
Right. Everywhere, right, in the United States or anywhere in the world for that matter, as whether it's an issue of health or anything. And on a personal note, I do want to thank you publicly for believing in me, because you gave me the opportunity and you saw that I was dedicated to this, and you gave me the opportunity to serve, and you put me on the path of public service, and it truly changed my career, and in many ways it changed my life. And so for that, I want to thank you for that. And I have to say, I have to fulfill a promise I made to you. I have to pack the family up, and I have to take them on vacation to Wisconsin, because I promised you that, and I have to introduce you to my family and have a chance to see your family again and come out there and have a nice dinner. So I will make good on that one.
But I love you dearly, Howard. You were really a godsend, and you're such a talented individual. And I hope your Docology podcast goes great, because it's badly needed. We need all the articulate spokespeople in the world talking about healthcare right now, and you're one of them. Keep doing it, Howard. And thank you for having me up.
Thank you. And this show, and that's it for our show today. Next time on Docology, we're going to be joined by someone who's an internationally recognized expert on vaccines, which is Dr. Paul Offit. And he's the head of the Vaccine Education Center at the Children's Hospital of Philadelphia. And he's been speaking about how vaccines save lives, just what the Secretary was speaking about a couple moments ago, and also about the misinformation out there. He worked on CDC and FDA advisory committees regarding these issues. But remember, if you're a Docology subscriber, you can join the conversation. Just sign up for the email reminders about upcoming episodes and at docology.live or Substack. And tune in next time, because the topic we cover may just save your life.
Thanks.
Docology is a production of Hang Media. Our producer is Catherine Warren. Ronnie Selig is editorial advisor. Our creative director is Anna Richard. Janine Wilson of Wilson Media Group handles paid marketing. Our publicists are Leslie Ann Wade and Jerry Caracoli. Theme music was composed by Nick Kitts. Subscribe and join our community at docology.life. Until next time, move, wash your hands, and stay healthy.